Greetings. I'm Dr. Robin Bonifas, an assistant professor in the School of Social Work at Arizona State University. I'm conducting a study on resident-to-resident aggression in skilled nursing facilities. Before telling you about my work, I would first like to thank the John A. Hartford Foundation for selecting me as a faculty scholar and supporting my research in this area. If you're like most people who I talk with about my research, you're currently asking yourself two questions. What is resident-to-resident aggression, and why study it? Let me begin by answering those questions. When you hear the terms elder mistreatment and nursing homes, likely the first thing that pops into your mind is the idea of nursing home staff mistreating nursing home residents. That does happen, of course, but the most common type of nursing home-based elder mistreatment is facility residents mistreating one another. So just to be clear, what I'm talking about, you have Mrs. Jones, who lives in the nursing home, and Mrs. Smith, who also lives in the nursing home, getting into an argument. Mrs. Jones slaps Mrs. Smith across the face and makes a racist comment. Mrs. Smith responds by kicking Mrs. Jones in the shins and negatively remarking on her body size. That's the most common type of elder mistreatment occurring in nursing homes. So now that you have a general idea of what resident-to-resident aggression is and why research on this phenomenon might be important, you're ready to learn about my work. First, I will provide some background regarding what we know about aggression between nursing home residents and how my Hartford Scholars research fits in. Then I'll explain what my study involves and what I'm hoping to learn from it. I will end by sharing some of the initial results with you. We know that resident-to-resident aggression usually takes place in the context of dementia. So it's not that nursing home residents are willfully and planfully mistreating one another. Rather, they're acting out during an episode of confusion when they're feeling threatened and have limited internal resources for resolving the situation. We know most aggressive incidents take place during the afternoon and evening hours in the dining room, in the hallway, and on special care units. We know aggressive incidents are triggered by stresses like overcrowding, invasion of privacy, and exposure to noisy, disruptive peers. And we also know that one of the most common staff responses when aggression occurs is to make a referral to the facility social worker. That is where my Hartford Scholars research comes in. I'm interested in answering the question, so then what happens? What does the facility social worker do? How does he or she collaborate with other members of the interdisciplinary team to complete an assessment and determine how to intervene? What intervention strategies seem to be the most effective, given the type of facility, the type of incident, and the characteristics of residents involved? My study uses a mixed method approach to examine these questions. The qualitative phase consists of individual interviews and focus groups with key people involved in behavioral management: social workers, the director of nursing, licensed nurses, nursing assistants, and activity professionals. From these individuals, I am learning about the processes used to both assess incidents and devise intervention plans, the types of interventions commonly employed, and the challenges they experience in responding to aggressive behavior. The quantitative phase examines specific incidents using both a prospective and a retrospective approach. I'm looking at incidents that have already happened and new incidents as they occur. Data collection consists of medical record reviews and brief discussions with facility staff to ascertain the following details: the characteristics of the residents involved, the particulars of the incident itself, the assessment and intervention strategies employed, and the outcome for involved residents 3 and 6 months following the incident. When data collection is completed, a multi-level modeling approach will be utilized to determine which assessment and intervention strategies predict positive outcomes across facility characteristics, resident characteristics, and incidence typologies. My research assistants and I are now completing the qualitative phase of the study with data from 46 staff interviews. So far, we have learned two interesting things. First, individualized approaches are only a part of addressing resident-to-resident aggression. Facilities engage in extensive organizational level intervention to create environments that help prevent incidents from occurring in the first place. This involves keeping residents engaged in meaningful activities, minimizing noise and overall busyness in congregate areas, and providing safe places for agitated residents to de-stress away from their peers. The second thing we have learned is that nursing assistants develop highly creative methods for entertaining residents in the dining room to minimize agitation that leads to aggression. However, when their supervisors observe their antics, they are perceived as goofing off rather than engaging in planned interventions and are reprimanded for their efforts. Thus, nursing assistants often feel devalued as members of the behavioral intervention team. These initial findings have important implications for social work practice. First, facilities that are struggling with managing resident-to-resident aggression may need additional guidance in not only providing individualized interventions, but in creating environments that minimize residents' agitation and subsequent aggression toward one another. Second, facility social workers must collaborate with nursing assistants to identify the behavioral strategies they employ on an informal basis and assure such approaches are incorporated into the formal plan of care and labeled as legitimate interventions. Thank you for taking time out of your busy schedule to learn about my Hartford Scholars research. I look forward to sharing the final results with you when the study is completed.